one thing I wanted to extra address, and Jonathan Mann being here and all of the interaction is so perfect. We had a past president panel. It has never been done before. And I mean, the room packed like this, it was wonderful. And so much time for people to do questions, but there was so many wanted to do. There was one person, and she doesn't know that her message, and I keep, I'm gonna stop. I need her to come up and read something. Yes, I know. Because we keep saying, oh, we want millennials in here. Why don't millennials stay where we're working? And something that day, and I'll talk about it after, yesterday, it made me click, and we'll go into that. Okay, here, let me get, and then we'll have to be just part of this mentorship. Here you go, unless are these, oh, never mind, I won't share. You go, girl.
Okay, wow, thank you so much, Board of Directors, Kathy, Mary. Thank you so much for having the San Diego chapter here and all of us here today and this week. Wow, I didn't know I was gonna have to do this. So yesterday, I briefly addressed the topic of millennial recruitment and retention. My name is Carly. I'm San Diego chapter member and secretary. I'm 28 years old. I have been a case manager for a total of 2 years, and before that, I was an ICU nurse for 5. I'd like to share with you what drew me to case management and what has kept me around. Autonomy, and at the same time, teamwork. Following the client, and I use client because now we're moving from patient to client, right, with patient-centered care, through their continuum of care. Being able to see the client holistically, which I see being implemented with the ICM model, and that was an amazing lecture on Monday morning from the pre-conference. The unique relationship that you build with your client, because they know you're only a phone call away. Seeing patients go from non-compliance to becoming activated in their care, and thanking you for being their first and only cheerleader. Millennials are really simple, actually, and all of you can relate to this. We like to be productive, and we don't like to waste our time or other people's time, including yours and our clients. We will ask why and question when people say things have always been done this way. We work smarter, not harder. We love to incorporate new technology. With Sharp Steely and Sharp Healthcare, we text our patients all the time. We love instant gratification, but I don't think that's so bad. When our clients call us and demand this and demand that and wanted it done yesterday, we understand that it's not being entitled, but it's going straight to the source and getting what you need. So I do challenge you as you leave this week with the following. Be open to new, innovative ideas and think outside the box, which I think you already do within your peers, but just remember that we're your peers too. Give us a chance. Let us challenge you with our ideas because we have some really good ones. Make us feel included, like we're part of your community, not on the outside looking in. As far as when you say, well, how do you hire people that don't have case management experience? I say look for personality, drive, strong work ethics, values, and integrity. Those are things that can't be taught. And then when you hire us, mentor us and teach us. We're excited, we're ready. Let us know what we need to know, because your vision as case managers is our vision too. So when
and I was listening to her, and because when then she was so brave and got up, it was, we were already going over, and with all the people, and we wanted to hear everybody, we announced, you know, if you don't have to leave, and please, we want to hear you. But a lot of people were leaving because they had places they had to go, and so the loud, we couldn't hear it all. But I could hear those points, and seeing her, well, my God, since I was 9. All 3 of my kids are millennials, and my 31-year-old, my oldest, lives here in Austin, and we wanted to have more photography as well to help our Kara photographer, but fill in for social media. And so she helped my communication staff and was sitting there taking pictures during this. So I'm seeing Carly Ann over here, hearing her, and I look and there's my daughter there. And I still, nobody's been more of a proponent for this, but I would still have my old 61-year-old self and 39 years of nursing and all. Sometimes all of a sudden I felt this weird click, like, oh, but she's so young, but I knew how special in their program, but I felt, and right away it went away, but I thought all of a sudden had this Oprah moment, you know, and looking at Shannon and then looking at Carly Ann, and it reminded me, and it made me click into what she said to help me, and if there's still some, because I know some of us it's still hard to accept, but shouldn't, because looking at that, I remembered when all 3 of them were teenagers, and at different times, old Darby's mom is such a friend to her. Why are you calling on that party? And oh, my other friends, they're not calling on if there's going to be a parent there. The answer was always, you have plenty of friends. I'm your only mom, and I'm going to be your mom, and one of these days you'll grow up and we can be friends. But right now I've got a job to do and you're my mom. Well, the kids now, every now and then will roll their eyes at me, but because I'm mom, but we're such good friends. And then they know, though, to cue me, because I've worked because these are always your babies, as a mom or a dad, but I'll cue and told them, just y'all keep me on track with this, and so stay as an adult, and every now and then they'll say something. It clicked to me. I think sometimes we're still thinking like these are our kids, and looking at that, and all of a sudden it dawned on me this was like the flip side of that. They don't need us to be a mom. They have moms. They're past that, yet they're not going to turn and go mom and roll their eyes at us and go, I know, like my girls, mostly my girls, then will tell me, no, I'm an adult, I can do this, I'm okay. And so they're not going to do this because you're probably their boss or as a coworker working with you. And it clicked. It's like they need now a mentor. They need someone to watch. They want to so bad, and that's often why we can't keep them, because we're not treating them with that respect, and we're not doing it on purpose. And that's what I realized. I think that's just an attitude we don't know is there, that we revert to mom or dad, and they don't need that. We need to remember, no, they're our peers, and we can learn as much from them as they can learn from us, and we have to remember that. So that's all. Love you.